I know so many, of course, opinions coming through with regards to level 2, some saying it's long overdue, it's a little too late, some saying, hey, let's still keep at level 5 because we're not necessarily in the clear yet. So let's get more clarity on that. The SA Medical Association has welcomed the easing of the lockdown, but it further warned that it's not the end of the fight against the coronavirus. South Africa will have, or rather has moved to level 2 from midnight, it will. Dr. Angelique Coetzee, however, the chairperson of the SA Medical Association, joins me now via Skype to have this discussion. Dr. Coetzee, thank you so much for your time. A warm good morning to you. And I suppose it's important to talk about this because some South Africans may think because we've now progressed to level 2 lockdown, it means that we are out of the red zone. Are we out of the clear just in as far as COVID-19 is concerned?
Good morning, and a good morning to all the viewers out there. No, we're not out of anything yet. It's going to take some time, quite a few years for us, before we can really say we are now done and dusted with COVID-19. I think what is extremely important for viewers to understand is that we will see a pattern of waves where you will get a decline, as we are now seeing, but you will get a second curve. Some from the beginning said that the first curve, especially in Gauteng, would be around the end of July, beginning of August, and we were not wrong. We also think, looking at how we understand from our side, especially at GP level, patterns, that the next wave will maybe be in 8 to 12 weeks, but we are going to see a second wave. People are now going to start to relax, and that's when the trouble is going to start. Unfortunately, we have to go down to level 2. We do not have a choice, and it is important for people to understand that level 5 was more there for the medical fraternity to get their house in order. It was not, and in that way to protect the patients, it was not there to bring down the economy. It was out of a medical viewpoint, but we cannot stay there. With the relaxation of the alcohol ban, it is necessary. We cannot take it away forever. But remember what Salma said right from the beginning. The abuse of alcohol with the consequent violence and high trauma rate is a symptom of a deeper underlying problem. And that needs to be addressed. And I don't think it's been addressed. You cannot in any case address it in 2 or 3 weeks.
Right. I want to get into alcohol consumption in just a moment and the pressure that is given to the medical fraternity. But first, you mentioned that second surge that we should expect as a country in as far as COVID-19 is concerned. How's the medical fraternity then preparing for this, especially just in terms of the challenges that you've incurred in the first surge, whereby there was, inadequate PPE, or perhaps if there was PPE, it seemed to not be of quality enough, which could accommodate the pressures of, the medical fraternity. So how are you preparing then, Doc, for the second surge?
So we learn, we're fast learners. So there's a lot of pressure now on the National Department of Health and provincial and the CEOs of hospitals to take responsibility for poor quality, the lack of PPE and the lack of understanding of their personnel. There is no time anymore to put the blame on anyone else except on yourself. If you're running a hospital, even if you get a donation, you have to make sure that there's quality assurance on that PPE. The second thing, we know oxygen. Oxygen extremely important for any of these patients coming into the hospitals, especially in the high care ward and in the casual ICUs. So we are hopefully preparing much better, getting oxygen ports, but you have to understand there's only 100 drivers in South Africa licensed to travel with oxygen tankers. So it is a problem, but that's what we now need to address for the second wave.
Also. And in terms of also just bed management, as you add on your point, Doc, please include as well in terms of bed management, because that seems to also be a challenge, right, in terms of, having field hospitals as well, just so that you can amplify, your bed management.
Yeah, I think it is also important to stress that a bed doesn't mean there's adequate personnel around that bed. Doesn't mean there's a doctor for that bed. So you can tell me we've got 5,000 beds, and I want to say to you, and what? So what? Because it doesn't mean a thing to me or to Salma. 5,000 beds means you need to have 5,000 people or dedicated HR management around that bed to be able to treat that patient. We also saw that a lot of the nursing staff that's not qualified to work in ICUs or with COVID-19 cases are taken from where they normally would work into these wards with dire consequences. Qualities then also becoming a problem as they have not been trained for that. So you put them into a difficult position, and you are also putting the patient's life in danger while doing that. So we don't have enough qualified nursing staff to man all these beds. We need to understand, especially doctors, that you have to treat each and every patient, although the curve is now going down, as a positive COVID patient. You have to wear your PPE. What I find amazing is that they understand that when you're working with a patient or when you are at work, that you need to wear your PPE or your mask. Let's use the mask. The moment when they go into the dining rooms, into the coffee time, everything goes out. Nothing. Masks is off, no 1.5 meters. This is not right.
Yeah, so there seems to be, more awareness that needs to be raised on that to still be, adhered to. Dr. Coetzee, it then brings me to my next question. I mean, on one hand, after the president announcement, it seems that industry, the alcohol industry, was quite relieved in terms of business, that the sector is opening up more. The sale of alcohol can now resume on Tuesday from 9 a.m. to 5 p.m. But if I remember correctly, the government also stressed how, the health fraternity was overwhelmed because of some of the repercussions of overconsumption of alcohol. So now that the alcohol, has been lifted, or that ban has been lifted, how are you then prepared to ensure that you're prepared should those incidents of, violence occur, symptoms around the overconsumption of alcohol occur, whereby now you are overwhelmed as hospitals while dealing with COVID-19 patients?
Okay, so the idea is that you would see less COVID-19 patients coming into the casualty, putting strain on the resources at casualty level. And therefore, you have a few more resources available for what we know is going to be the same pattern that we always seen before, and as this is the behavior pattern of South Africa. Especially in certain communities, you will find that the incidence is quite high. So those facilities that know that they will have a problem, there must be consultation, if it's a public sector hospital, with their National Department of Health and Provincial Department of Health, as to make sure that you employ enough doctors and the correct nursing staff with the correct skills to address this. We need to fix the problems that's been there for many, many years, and no one made any effort to really, really address it. It was always sort of swept under the carpet. We cannot sweep under the carpet anymore. We need to be out there. We should take responsibility. And again, Salma would like to urge each and every doctor, patient, nurse who encounter problems, please mail us. We've got a whistleblower project, and I promise you that all those queries, the ones that have been sent to us in the past, has been escalated to the National Department of Health, to Minister, and to the relevant people working with this.
All right.
Because the Minister feels the same as Salma. Unacceptable.
We'll leave it at that. Thank you so much. Dr. Angelique Coetzee, the National Chairperson of the SA Medical Association.